Let's talk about our health now. A study just released today by the Marion County Public Health Department is taking a look at the community's health over the past year.
Now, the department conducted the study with nearly 5,000 Marion County residents. That's how they compiled the information. Our Ella Rhodes went through the 200-page report. She joins us now. We heard her in the newsroom earlier, digging through the report, trying to find some of the most pivotal information for our viewers.
As you guys can see, it's quite a lot of information here. So there are 5 key findings MCPHD highlights that are people's top health concerns. So mental health access to health care, as well housing, trauma and injury prevention, as well as infant mortality. So we broke down the stats that stood out from a few of those categories.
Every 4 to 5 years, the Marion County Public Health Department conducts this study. Dr. Virginia A. Caine says it's all to improve the community's quality of life.
It's really critical that we have resources in order to do the work that we do from a prevention standpoint. Also, it's going to save an enormous amount of dollars.
A major priority? Access to health care. 1 in 3 people in the county say they have a medical bill they can't pay in full. 1 in 5 people reported they didn't see a healthcare provider in the past year due to high costs. Nearly 1 in 5 also say they didn't access their prescription medication or took less than directed because of the cost of the medicine.
We need their input. So we can't be maternalistic and telling them what they need. We need to ask them, what do you need? What kind of resources? And what would make you more receptible to improving the quality of your life.
Dr. Elizabeth Bowman believes the economy and inflation play a large part.
What it really tells us is that there's unequal benefit to improvements and investment dollars around the county, and there's more we need to do collectively as a system to benefit all of our neighbors and residents.
Also in the top, trauma and injury prevention. 25% of residents say gun violence impacted their friends, family, or neighborhood. The assessment shows the firearm homicide rate in Marion County from 2018 to 2023 was 3 times higher than the Indiana and U.S. average.
I think it's things that people have understood are problematic for a very long time. Mental health being a challenge isn't a new thing, or access to health care. But it's good that we are all on the same page about the ways we need to move forward to improve our community as a whole.
The results are just the start.
We're not giving up in local health. You know, we're going to be talking to our policymakers, our state legislators,
to improve everyone's quality of life.
So what's the solution? That's kind of what I asked Dr. Caine, and she says that's kind of a longer process. Right now, they really are relying on the community's input and feedback to hear what they want to, help solve some of these issues and just have that in community engagement to really guide them. But this just truly scratches the surface.
Yeah, there's so much there. You talked about mental health needs at 4 o'clock.
Yeah, there was significant statistics talking about, 1 in 4 people in Marion County dealing with depression. So it's just so much to really go through. And if you're interested to learn more about this study and even read it, you can head on over to WTHR.com to read the full report.
Okay, thank you so much, Ella Rhodes, reporting this evening.